Dr. Lisa and Dr. Gary are my parents. They started our practice here. Yes, I know, so fun. So, family vibes, and we are partnering with Fruits Beauty tonight. They're here, they're amazing. And we love to put on different workshops with just different health topics to give you guys all the tools and resources you need to live your healthiest life. And so that's our mission, is to really see as many lives change for the better using unique integrative medicine and seeing people restored to really do the things they love. And so we put on a lot of different workshops like this. This particular workshop we started years ago, I think it was 2016, and we first called it Beauty from the Inside Out. We partnered up with Roots and we're like, let's talk about non-toxic beauty, and we've done it many times ever since, and it's been so fun. This one we're expanding a little bit more to talk a little bit more about other skin issues and talk about the secret culprits behind those things, and then we're going to move from that into more about our non-toxic beauty. And then at the end, what Dr. Lisa is going to do is she's going to do an assessment with whatever beauty products you brought. She's going to do some assessing with you, and then we'll have Roots here to basically show you some non-toxic beauty products and some options. And so at the end, we'll kind of move into more of an interactive time for you guys to be talking with Dr. Lisa, talking with Roots, and talking with me. And then, yeah, so it's going to be a really fun, packed night. We'll have a question and answer time at the end, but if you have, questions throughout, you can ask away. And I'm going to hand it over to Dr. Lisa. She is an amazing doctor. Yes! And has helped me with so much of my health. And she's a chiropractor and naturopath. So she sees these skin issues every day and has helped so many people get through these things. So she's a wonderful resource. And then just a little bit more about Roots. They are in downtown Laguna, non-toxic beauty products shop, as well as hair and makeup. And I get most all of my beauty products from them. How long have you guys been there? What is it? 10 years. 10 years! So, they're amazing. So anyways, we're going to get to know everybody here tonight, but hope you guys enjoy and you get going.
I just want to give Roots one more plug. My oldest daughter, got married this year. And literally, I was just telling Laura that literally the best part of my day was them coming out on our deck. We have all these umbrellas over the deck, and all the girls are getting their hair and makeup done, kind of like, came in and out. And it was so fun and so lovely and so relaxed. It was awesome. So thanks, you guys. So just to know that they do that too. They will come to your house and they do hair too. They do hair styling and hair coloring and non-toxic. It's awesome. Okay, so I'm going to start talking about the skin tonight. And one of the things, does anybody in here know what your largest organ in your body is? Skin. So do you think it's a little bit important? Okay, and the function of the skin is what? Who knows? Barrier. Yep. Detoxify. Yep. What else? Protect. What does it do with the sun?
Absorb.
Makes vitamin D. You guys know your vitamin D factory is in your skin. Yeah, it's in your skin. So, yeah, I think sunscreen's important, but I also think we're overusing it a little bit. And if you guys, if you want to get out in the sun, it's good earlier in the day. No sunscreen, just get some sun time later on in the day. I think sunscreen's more kind of for the middle of the day, personally, but yeah, so it makes vitamin D. Do you guys know you guys have all heard about your gut biome, right? How about you guys heard about skin biome? Yeah, you guys have a skin biome. And it gets kind of mantled on you when you come through the birth canal. Kind of your skin biome from your mom. It's kind of cool. And you've got about 1,000 bacteria in your skin biome. You got fungus too. And so when you start kind of messing with your biome, that's where you can kind of have some problems. So we're going to talk a little bit about the biome tonight and some of the like acne and things like that. Sometimes it can be because the biome's a little bit messed up. So that's kind of a couple I'm sure you guys can kind of come up with some things that might harm your biome. Oral antibiotics, right? Oral antibiotics definitely kind of like, just like your gut biome, it kind of does the same thing to your skin biome, right? Harsh chemicals. So, you know, when you remember, what was that product that people would use for acne back in the day? It was all That's like one of the worst things you can do to your skin. It's such harsh chemicals, and it really changes your skin biome, and it changes the pH of your skin, because your skin's pH is, you know, it's kind of slightly acidic. It's like 4 to 5, and it's this little sweet window. So when you use those kind of products, it really messes with it. What about like antibacterial soap? Bad stuff. And Roots brought something tonight. It's in your little goodie bag, and it's not an antimicrobial, it's not antibacterial, but it's something to help if you need cleansing, and you don't want to use that antibacterial soap, because that's really like, and can you imagine if people are like doom and gloom? How bad that is for you? It's like horrible. So that's something else that really messes with your biome. Or, you know, pollutants in the air can mess with your biome. So you really kind of want to protect it, like you want it, like keep it protected. Let me see, did I miss anything? Well, bad beauty products, of course, that's why Roots is here. Like bad beauty products is horrible. And a poor diet will mess with your biome. Okay, and a healthy biome is obviously like getting vitamin D, eating healthy, keeping your gut healthy, you know, those kind of things, hydrating, making sure you do get sun. You guys, we all need sun to keep our skin healthy. It's like, it's important. I think we've kind of swung the other way and are afraid of the sun, and we need to not be afraid. It's our friend, as long as we, you know, use it in a wise manner. Okay, so Maria's made some beautiful slides. So we're going to go into what are the culprits behind common skin. So let's look at acne. And so she put secret culprits are like detoxification, food intolerances, especially dairy, liver dysfunction, gut issues, toxic beauty products. So one of the things I want to say too about acne that I've found recently is women that are coming off of birth control pills. I don't know if any of you have experienced that but coming off of birth control pills is gnarly, and people get acne. And one of the things, okay, let's kind of talk about acne. Like, think about, when does most acne happen? Because it's going to make your brain start going, oh yeah, oh yeah, oh yeah. When does it usually happen? Teenagers. So what's happening in teenage years? Hormones. So does acne, you think, go along with hormones? Yeah. So what do you guys know about detoxifying steroid hormones? Because think about it. You make steroid, like those who are still menstruating, I'm not, but those of you who still are, you're making steroid hormones, right? You make them every month, and then what happens to them? Do they just live in your body forever? No. They go away. They go away, and they go away because your liver detoxifies them. So your liver is super important, and that's probably one of the things that's going on with the, you know, with young people, with their teenagers. All of a sudden, all these hormones, and they probably don't have the systems in place in their liver and their gut to really get rid of it. And that's because we're exposed to more toxins, and their diet's probably not that good. They're probably not drinking water, but the liver needs about 40 nutrients to take a product like steroid hormones, estrogen, and break it down and go through the 8 steps, and into the gut it goes, then it's in your gut, and then it goes by. So if your gut is backed up, you're not drinking enough water, you're going to reabsorb those steroid hormones, and you're going to have too many. And that's why people go crazy when they have too many. So you really need to be able to detoxify, and there's amazing liver detoxification products out there, like amazing. And remember, you need 40 nutrients. You need B's, you need magnesium, you need omega-3s, you need manganese, you need magnesium, you need CoQ10, you need all those things in decent amounts to detoxify. Also, food intolerances can definitely cause acne, and dairy is one of them. And it might just be an intolerance. It might not be a full-blown allergy, but dairy definitely can contribute. Digestive health, we talked a little bit. One of the things, you need your gut to be moving, and you know, a bowel movement a day is, at least one is essential. If you're not having a bowel movement a day, something's going on with your gut. So that would be something to look at with acne. And use clean products, and that is so important. because the skin absorbs those, and if it's absorbing products that are toxic, whatever in your beauty regime, that's not a good idea. So eczema. So eczema I've found a lot is food intolerances. And so it can, you know, it can be wheat. Have you guys ever seen people with bumps on the side of their arms? That is wheat. That is wheat. And you can actually take food sensitivity tests and it will show you where the wheat is actually bothering you. It's so fun because you'll see it on a person, they'll take that test and the test will go, yeah, the wheat is bothering your skin. And then it's like, yeah, it is, it's on your skin. It can bother your gut, it can bother your brain, it can bother, you know, different areas in your body. Sensitivities can. So eczema can definitely be coming from food insensitivities. It can also be coming from your detoxification that's not happening well. So detoxification is so important, and there's just, we need to spend more time on it in our life, like make it a priority. Like we do what? Detox to Flourish twice a year, huh? Mm-hmm. Where we encourage people to do a detox program and clean out their liver, clean out their gut, eat, you know, stay away from alcohol, sugar, dairy, wheat, grains, and caffeine. Mm-hmm. And then you do that for 21 days or something, and it's amazing. You feel really good. So rashes. So one of the things I see quite a bit of is candida. Mm-hmm. I gotta tell you a great candida story. It's so fun. So I have this gentleman, and he's come into my office kind of over the years, but he was there for his daughter. And he had a beanie on, and I'm like, why do you have a beanie on? No, summer. He goes, and he takes his beanie off, and he goes, and he had this hair loss pattern, and it was like this. And it was such a strange, you know, for men, you know, they don't bald like that. They bald like this, right? But this was like a perfect, like, I go, wow. I go, that looks like you might have candida in your hair. And he goes, really? I go, yeah. I go, lie on my table and let's see. And so there's ways that I can find out if you have candida in your hair follicles in your skin. He had candida in his hair follicles. And then he started telling me the story, what happened. He got hit by a scab surfing. He had got it stitched up right on the boat. It got infected. He went on antibiotics. He came home and then he had some sort of tooth issue and he had to go on antibiotics again. And he goes, and after that happened, my hair started falling out. I'm like, wow. So I put him on a candida protocol. Guess what? His hair's back. Isn't that a trip? So I mean, candida can be in your hair follicles. It can be under your nails, right? It can be on your feet. People with cracks on their heels, they think, yeah, my skin's dry. No, you got candida. That's what that is. It can be when you get cuts on the side of your fingernails. It can be in your mouth. It can be in your vaginal tract. You know, so candida can be everywhere, and if it, you know, it can be on your skin, and it likes moist places. So, right, vaginal area. I mean, that's baby's mouths. So candida can be part of it. You can have, since we talked about the biome, you can have a, you know, disruption in your biome for whatever reason. That can cause rashes to dry skin and stuff like that. So then Maria put wonderful things on there, the solutions for the rashes, looking for the candida, detoxifying, putting a biome back, and that could be, you know, in your gut, just getting your gut healthy again, finding out what food intolerances you have. So cracked, itchy skin, that's most of the time like we were just talking about is candida. And going on a candida protocol, which is not fun. But it works.
Is that the diet?
That would be a diet, and that would be staying away. You know what? All bugs, whether it be a bacteria, a fungi, a parasite, viruses, they live on glucose, which is what we all live on, right? And then if you switch to like super low carbohydrate diet, keto diet, yeah, then you can get rid of those bugs. I went to a seminar once. It was probably one of the most impactful moments of my life. I was listening to this doctor, and he had the screen up, and he said, I am going to put on 20 different slides of live blood And Gary and I were sitting there, my husband, and we were watching the slides go by, and he goes, okay, I want you all to look at those slides and see what you see in them. So we're sitting there, and it's like, okay, there's a white blood cell, okay, there's lots of red blood cells, you know, they're round, they're disc shaped, you can see the white blood cells are big, they've got different nucleuses. And then Gary and I are sitting there, what's that? And it's like this long kind of smooth, oh, that's probably a fungus. You know, what's that? Oh, that's probably bacteria. And he kept throwing these slides up, and they were all the same. They all had some sort of critter in the blood. So you know, if your blood is breached with the bacteria, or you can't see the viruses, right? That's why they don't go. That's why they go through masks, my opinion. But they're super small. And then bacteria. You can bacteria and parasites. And so then after we went through all the slides and they looked the same, he goes back through them all and he goes, this slide, that's ADHD. This slide, that's cancer. Wow. This slide, that's epilepsy. This slide, that's arthritis. And so bottom line is, you guys, we're fighting a little war against these microorganisms. And some of them are beneficial, and some of them are beneficial until they become too many, and then they become non-beneficial. Like the organism that causes ulcers is beneficial, but if it gets out of control, they cause ulcers. So going on a detox protocol, you know, going on a keto diet, fasting, you know, doing these things, you know, a couple times a year helps you kind of keep all those critters in check. It really does work. Okay.
Dr. Lucy, before you go into the beauty products section, do you want to just, anybody who has any questions on those specific things?
Thank you.
Or is struggling with one of those things that they want to take a look at? Also, isn't there a story that you had, that you shared recently about some patient that was a young girl, and it was like one of your most amazing turnarounds, and I think it was about the skin.
It was, yeah, she had been suffering with just skin rash, itches, and so she came in, I said, you have candida, I put her on a candida protocol. When she came in, she said, I have been to UCLA, I've been to every doctor for this skin rash that I can think of, and they've all told me that there's nothing I can do, and I said, well, you know, I don't have a license like they do, I'm not a medical doctor, but I think you have candida, and just try this candida protocol. And she never came back, but she wrote me a letter and said in 2 weeks I was completely clear. Wow. Yeah. Yeah. Those minor miracles like that, because usually it doesn't take 2 weeks. Usually it's about a 6 weeks protocol, and it's hard. You gotta stay away from sugar.
Versus it's candida, if you have rashes, just during periods when you're very stressed, or
Could be, because anything, you know, the thing about stress, it's such a weird word, right? Like, how do you handle stress? You know, it's a hard thing to handle, but, so it can be candida. But candida usually comes out when it's cold and dry. Usually, that's what it usually, but stress can cause it too, for sure. And like, you know, you go away for a weekend and you drink and you have a lot of sugars and it comes out more, that could be it too. Pregnancy can bring up candida too. What do you say? I like that person, that girl right now. I've gone to so many doctors, so many things, and I'm wondering if I have candida. Because, can I see it?
Yeah, I mean,
Is it on your hand?
it's on my hands. I did a round of steroids, which I'm embarrassed to say, but I was in such desperation. It looks good right now, but if you,
I think you do. Does it get worse during when it's cold and dry, or? Yeah.
I can't even, like right now, I had to do the steroids with paper because I couldn't function with my hands.
Oh yeah, right here.
Turn this way. Can you see like the
Yeah, right here. Oh yeah, totally.
Sorry, this is really gross.
No, you have candida. This is candida.
Really?
Oh yeah,
I
absolutely.
literally have gone to so many dermatologists. I'm going to another dermatologist tomorrow. No joke. And I'm hurting.
And you know what's weird? Dermatologists, in a sense, they don't really recognize candida for some strange reason.
They said it was dyshydrotic eczema, but I've had this only, I got it, I've had it for 3 years, and it just came out of nowhere, and I'm like, yes, I know. And then my foot is, you said the cracked heel, I have all that.
Yeah, cracked heel. So, is it kind of gotten worse since it's kind of gotten cold and windy?
never take them unless I really have to. And my mastitis is brutal. Yeah, so she would bite on Jam and was like, you have to do it. I did that, and I haven't been on anything since, but I take a probiotic. I mean, I drink tons of water. I eat clean.
I know, but once you have it, to get rid of it is hard. Okay. You have to really go. You have to go after it.
I know, I will do it.
Yeah, great. Yeah.
I'm like, so yes. I never said eat sugar again.
Or-
Because
So this is the thing. You have to go on a keto diet for a while, but you have to take something that goes after it. You can't just like literally. If you go on a keto diet, it might take you a year to get rid of it. But there's antifungals, natural things that work. And Karen, may I use you today?
Please do.
So-
I'm over here dying.
Yeah. So Karen was in today, and we found fungus on her, and she saw me pull out all the different fungal things, and it's like one works. So it's like you maybe have a drawer of 10 things. This that treats fungus. This, and then you pull out one, and it's the one that works, right?
Mm-hmm.
And then so you realize that you could go to the Whole Foods, or you could go to Mother's, and you could go, this is going to kill my candida, but it just might not be your potion. Everyone's different.
And I was shocked because I've been seeing her since April once a month, but I haven't seen her in a few months because just life. But I have this patch that has grown on the back of my head, and I told her, oh, it comes out when I'm stressed. But I'm not sure that's what it is. And so and I did go to the dermatologist, and she said it was seborrheic dermatitis. And so it would pop up over the years, and I would just put the tar gel on it. But she said, let me test you for candida, and sure enough, it shocked me. And yeah, just like she said, she tested it was a long time.
Yeah.
You went to find it, they had to figure out
They found it a lot. Yeah, in hair follicles. You have it in your hair follicles. I found that a lot. Yeah. So yeah, looks like it to me. Yeah, yeah.
Diagnosis is like 90% probably.
Yeah.
Yeah.
I used to have it on my hands too. Yeah. No, not necessarily. I mean, I've had it vaginally, I've had it on my hands, but those are the only places. No.
My 2-3-year-olds.
No. It's not contagious.
Okay, that's what I
No, it's not. Anyone else got a question for me before we go on to that question? Yes.
Can candida be seasonal, like when the cold weather starts?
Can candida be seasonal?
Yes.
Totally. One time it was Thanksgiving, I had my hands in the water all day. And then all of a sudden silly me, I kind of like, was like, what is going on? And like a couple weeks go by and I'm like, oh, duh, this is candida. So it's like, Thanksgiving, it's colder, hands in the water, and it's just like there. And I had it all in between my fingers, and yeah. So, yeah. It's not a hard fix, you just gotta do the work.
When you diagnose candida,
Okay, so one of the things we're gonna do tonight is I'm gonna muscle test you guys. Alright? And with muscle testing, think about if you went to the neurologist and you had neck issues. The neurologist would go, okay, let's see what segment this neck pain is coming from. They muscle test your deltoid, they muscle test your bicep, they muscle test your tricep, they muscle test your finger flexors, okay? So that's testing the integrity of the muscle, right? And I'm gonna do that tonight too. And what I believe, and you'll get to experience this tonight, that that muscle testing can be used when you insult the nervous system. The muscle will temporarily weaken. And if you have a weak muscle and you introduce something that's going to be beneficial for that problem, then the muscle will strengthen. Yeah. So you'll see that tonight because I will actually muscle test you, and it is undeniable that if there's something that insults the nervous system, the muscle will tell you. Yeah, it's very cool. If you've never muscle tested before, you'll like it. Yeah. Isn't that bizarre? And you know what I find? That's happening more now than ever. Ever.
Why do you think?
I have no idea. Because most people go on birth control pills to,
Yeah.
right? But I've found that I've had like 20 women come in the last year that have gotten off birth control pills, and that's their one symptom that they have that is the hardest to get rid of, and they're struggling with it. And it will take 6 months to a year and some work to get it, because you have to get your liver up and going. That's one of the biggest things. And the birth control pill, the hormones hang out in your fat cells, so you got dry brush and sauna and exercise. Get it out of your fat cells. Okay, Mo.
You can just tap on it to make it
So
back up.
as we go into this next phase, I am going to call on our roots, lovely women, Laura and Mary, to kind of like pop in and say stuff and and help me out. Okay, so we're going to learn about beauty products because in America we have different rules than Europe.
Yeah.
You guys all know that. And so we have some toxic beauty products. But Roots has some awesome beauty products that aren't toxic. Okay, so the effects of toxin in your beauty products, that means your shampoo. And the other thing we have to think about when we're thinking about not just beauty products, but like, what are we washing our clothes in, right? What are we laying on at night when we sleep in our bed? Like, all that stuff we have to think about. What are we putting underneath our armpits, So hormone disruption, damage to the endocrine and reproductive system. We all know that. Skin damage and disease, negative allergic reactions, and linked to cancer. That's horrible. In 26 seconds it takes for the chemicals in your personal care products to enter your bloodstream. I've also read that let's say you have a toxic chemical that went into your bloodstream and you think if you take a shower you're going to rinse it off. No, it's in. On average, the American woman uses 12 beauty products a day, resulting in exposure to over 100 chemicals before we leave the bathroom in the morning. Wow, that's a war we can win, isn't it? We can win that war.
Do women have more cancers than men?
Than other countries?
Because we use
Oh,
more
than men?
products.
That's a really good question. I don't know.
That's really good. I mean, I don't think men are using like one in one
That's
product.
true. That's true. They are.
Curious.
Or different types of cancers.
Yeah. Right, this out really quick.
The deodorant's a hard one for me because my job's incredibly stressful, and if I would like to use a natural deodorant, but there's no way I cannot stress sweat at work.
No.
So,
What have you tried?
I mean, like, I think I brought one tonight. Secrets. I'm sure it's super wonderful. I'm sure it's killing me.
Right.
But at least I don't smell, and I'm not.
That'll be fun to try.
Yeah.
Laura, got any ideas?
Yeah.
Really for stressful work and
Totally. We've got like a really large array of clean deodorants, and it's not one size fits all. It's very much, we like to make you guys samples, send you home, have you test things, come back and get what works for you. That's like really important that we do that with you guys. I do find like this is very much saying what Dr. Lee said. It's about the detoxing of the armpit. So it's like all that aluminum from The Secret has been clogging your pores, and that's what's keeping you from sweating, right? Aluminum. So you really do have to commit to like a 2-week purging process, detoxification of the aluminum from the pits. And there's never a good time to do it. You honestly just kind of announce to everybody that that's what you're doing. And educate them on why, And so you get your detox on, and then you get your accurate deodorant, and now you're all balanced, But like anything, it's difficult, but it's possible.
And you've seen women find the right deodorant
For
that
10
works.
years straight.
Okay.
isn't that awesome that you can go get samples and you can try them?
Yeah.
That's
So we'll like
amazing.
make sure not just sending you out and figuring it out. We'll get it right.
Well, I was just gonna say, in like the meantime during the detox process, like they have those super natural like deodorant wipes. You can like wipe yourself down in the middle of the day. Like I did that until like I feel like I don't even need deodorant now. Like
Deodorant and tablets that are like, because even with the natural stuff, you still sweat. Like, you'll be wet. It's not antiperspirant, it's just like,
but like
and fitness industry. So I'm like literally sweating, but I feel like I don't smell like I used to before I switched to my whole everything. But I still have so many questions.
So that, I think that's amazing. And I use a deodorant that has a little arrowroot powder. Do you have something like that? Oh, yeah. Because then the arrowroot powder, like talking about the bacteria, kind of absorbs things, and that works awesome for me. Because I'm a sweater too. Yeah. Okay. So so one of the things I love about Roots, it has this. What's that card called that you pass out?
The Dirty Dozen.
The Dirty Dozen. And it's in your bag. And so this list is kind of some of those things, the Dirty Dozen and the things. You can just have it stuck in your wallet or in your phone, and then you guys can always know, like, is this in my sunscreen? Is this, the sunscreen you pick up, is that in there? So these are some of the Dirty Dozen that you totally want to stay away from. So it's just that little card.
It's in the brown bag within the bag.
And there you go. So one of the things I found in muzzle testing women to their products is fragrance. Is definitely, if somebody brings in something that has fragrance, it usually always muzzle tests that. I have a funny story. I had this one woman come in one time, and she came in because she had allergies and all these issues, and I took a history and we got to the bottom of it. She was a Bed Bath and Beyond everything. She was the candle, she was the soap, she was the. And I looked at her and I said, "You're gonna have to just purge. You have to." And I never saw her again. So then I would love to know, did she or did she not? But it was like, her life was really miserable because of this. And I've had patients that can't even walk by the outside of it. Yeah.
That's me. Yeah.
Yeah. They can't even walk because it's just so intense. Okay, so this is really amazing. The year the government law last passed a federal law regulating cosmetic industry.
What?
That's because they make money. That's true.
Isn't it true?
That's awful. Yeah. Make money off of us being sick.
Yeah, big part of that. Exactly. Well, doesn't it blow your mind that the American Cancer Society has never come out against aluminum antiperspirant? Like, has the American Cancer Society ever told you anything that you should stay away from? Ever once? No. I know I can't do those walks either. I'm sorry. If you had some information for us as citizens that we could do to better our life, I would. But this is the kind of stuff that happens, and so we got to educate ourselves because they're not educating us. 1,400 versus 11. Other harmful cosmetic ingredients banned in the European Union versus the U.S. How about that? Yes.
England and Heinz here, and
Yes.
England it's tomatoes and water.
Exactly. That's
And
all
here,
over
like,
that.
the little words I can't pronounce.
Yes. Have you ever seen the picture of school lunches? That one's really good too. School lunches in America versus school lunches in Japan. In Japan, they have whole fish with eyeballs on there, rice, seaweed. It's like, wow, that's a good lunch. Versus French fries, ketchup, and a burger.
Eyeballs, we don't want that.
No, eyeballs are good for you. Those eyeballs. Okay, let's look at. Okay, so we're looking at sodium lauryl sulfate, which is in. Would you guys know what that's in? And soaps, right? So this is the second most concentrated ingredient in shampoo. It is used in concentrate to be floor cleaners, engine degreasers, car wash detergent, and just about every soap and shampoo on the market. In the same way that it dissolves grease on car engines, the chemical that dissolves oils in your skin. So do you think that would wreck with the biome? What do you guys think? I think so too. The chemical is capable of changing the information in genetic material found in cells used in studies to induce mutations in bacteria. It causes inflammation of skin, separating skin layers, denatures proteins, and can impair a proper structural formation of young eyes and damages the immune system. So, we all love a soapy shampoo, but right? So, let's, what should we do? So, tonight, we're going to go through, look at some of the things that you guys brought, some of you guys brought your own things, and then Roots has samples in the bag, and we can check them with that foundation in there. There's some, is it lip colors, lip tint.
We just tried to bring like a little array, but of course, like the shop is like full spectrum, and we have a solution for everything. So whatever your specific need is, just plan on coming in.
Okay, so, this is, since there's quite a few of you, and I want you all to get tested. I really want you guys, I think it's really important for me to test all you guys. Where's Maria?
She's downstairs. I'm holding